25-year-old female with weak chin and large cheeks. Suggestions on procedures to achieve desired face. Never had plastic surgery. I am considering getting injections for my lips and some fine lines between my brows. However, I have always had an issue with how round my face is and my weak chin, and was wondering if you could suggest what procedures are required to get a more heart-shaped face. Many people have said that I have a nice, unique face, so I wouldn't want the results to be so drastic that I lose my character. I attached many photos for reference. Any other more general procedure suggestions you have are appreciated.
Thank you for your question. You're 25 years old and you've submitted several photos from multiple angles to ask about essentially a desire to have a more heart-shaped face and that you feel that your face is too round and that you have a weak chin. Well, I can certainly share with you how I would go about evaluating an individual like yourself who would come to my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years and helping people achieve improvement of their facial harmony is something we do pretty much every day in our practice at, of course, very different ages. Now, I think that when you look at yourself and you see these areas, you also state in your question that you don't want to lose the character of your face. And I think that my first thought when I see your pictures and I read this question is first understanding that your face is also continuing to evolve. And at a face that may be on the rounder side at 25 may be significantly more angular by 30 or 35. And why is that? Because as we get older, we lose what is often referred to as baby fat. And so when you feel like your face is too round, although there's certainly some people who have family traits where everyone has a very round face, I would say that if you want to get that, quote, heart-shaped face, that the way to think about that, quote, heart-shaped face is in a concept known as the golden ratio. The golden ratio, or phi, derived from the Greek equation for beauty, is a proportion of 1.6 to 1. So when you see attractive models in magazines, their cheekbones are a certain width, which is proportional to the jaw or chin area, which is a 1.6 to 1. And I think that's kind of what you're looking to achieve. Now, when you refer to a weak chin, it is very important to differentiate a chin that might benefit from some type of augmentation, whether it's a chin implant or an injectable filler, or if what you have is an underbite where the teeth, the lower teeth, are more posterior or back compared to the front, or what would be the norm. So this is something that also has to be appreciated. It doesn't mean you always have to fix everything, but to understand the difference between an underbite versus a weak chin. Typically with a, quote, weak chin as a standalone issue, the options are to do a chin implant, which we do fairly routinely in our practice, as well as soft tissue filler, which actually we do a lot more of because it's just much more convenient. If you really wanted to do something at this stage of your life, I would consider, just for trying out, if you're going to do something, I would say a soft tissue filler like a hyaluronic acid filler placed in the chin can give you a certain perspective of how your chin looks with a little bit of enhancement. It's a choice where I think you can get the benefit of doing something that's going to actually make a change, and at the same time give you perspective on how it affects the whole structure of your face. I think that, and this is a little bit of editorializing, but it is perspective as a doctor in this field, that a lot of people who are younger get very focused on certain specific areas of their facial anatomy that they feel is undesirable. And I often try to counsel them that at this stage of your life, this is like the best you're going to look for a while, and before you start hitting your third and fourth decade, when you start to lose some volume. So it is important that, yes, your character is very important, and I think what you're looking for should be something subtle but not too dramatic. Again, distinguish as far as the roundness of the face is concerned. I know that there would be, if you went for consultations, someone would recommend like buccal fat pad extraction, and I think that it's a bit aggressive, especially in a face that might be maturing, or if there's going to be any anticipated weight loss for a variety of reasons. And as far as the chin is concerned, I think thanks to these soft tissue fillers like Juvederm Voluma, we can actually place a filler and get comparable results to a chin implant, and at the same time do it in an office setting without putting the patient through surgery. If the patient really likes it, then we can go ahead and do the chin implant and give them one that works for them. So certainly there is some room to explore, but at the same time I would say that I would advise you not to be overly critical and appreciate the many positives that go with this stage of your life and your appearance, and take it from there. So I hope that was helpful. I wish you the best of luck. Thank you for your question.